Hey everybody, I'm back here in beautiful Balboa Park, San Diego for a follow-up to my original How to Walk Properly Top 10 Tips video. If you're new to the channel, I'm Dr. Todd Martin, creator of the Walking Code. So without further ado, let's go ahead and get started. Tip number one is simply being aware of your walking technique. Most people walk around their whole lives without any thought to the way they're walking until walking begins causing pain. And even in those circumstances, people often don't realize the way they walk is what's causing the problem. Most people are aware these days of the slow chronic damage that can occur from things like high blood pressure and diabetes that don't cause any symptoms until they lead to problems like stroke or heart attack. Poor walking technique can be similar. The high impact and increased stresses on our joints, ligaments, and tendons over time from poor walking technique can lead to medical issues like chronic plantar fasciitis, knee arthritis, and hip arthritis, as well as lower back pain. Many of these problems develop without any particular injury, and most people are unaware that it may be their walking technique over the long term that has caused these problems to develop. Being aware of the way you walk and your posture and your impact on your feet, trying to walk more fluidly and more softly can help people preserve their joints for a longer period of time so they can live without pain. Like most other people, I wasn't always aware of the way I walked. I didn't realize that I had to work on my walking technique until one day, about 18 years ago, I was walking down this very street in Little Italy, hand in hand with my wife, when she suddenly yanked her hand out of my hand and said that I was yanking her shoulder because I was leaning forward when I walked. I had no idea that I was doing that. That's what led me to working on my walking technique, studying Tai Chi, and ultimately developing the Walking Code. I didn't have the benefit of YouTube at the time. Hopefully, many more people these days will have this sort of video put in front of them, making them aware that they'll need to work on their walking technique. Tip number two is eyes gazing forward when you walk, looking in the direction that you're going. Now that is a common tip that most people would recognize, but I used that tip in my previous video and I heard from a lot of you who didn't like it. Many people commented that if you're not constantly looking down at the ground when you're walking, you're going to trip over cracks in the sidewalk or other hazardous objects. So I wanted to go back to this tip and explain a little bit more. First of all, if you are one of those people that feels you are at risk of falling, the fact of the matter is studies show you are at risk of falling. It means there's something going on with your balance or your mobility that is putting you at increased risk, and that should not be ignored. You should go to the doctor and get checked out, likely seeing a physical therapist to assess your balance and your mobility and your fall risk. There are things that can be done to reduce fall risk, like particular exercise programs. Tai Chi is especially helpful for reducing fall risk in older people who feel out of balance. Now, for those of you who have normal balance and do not typically feel like you're going to fall down and trip over things, the eyes should be gazing forward when you walk because that is part of proper posture. When we're standing, we should have vertical alignment of our spine from the lower back and pelvis all the way up through the neck. And that requires the neck to be aligned with the thoracic spine, and that's going to have our eyes gazing forward. Now, it doesn't mean you can't glance down with your eyes as something is coming up, or even dissociate your neck from your torso to look down as you're approaching something that's coming towards you. But if you're walking with your entire spine and neck pitched forward, so you're constantly looking at the ground, that is not good posture, and it's going to cause wear and tear in your cervical spine and in your lower back that's going to lead to pain. Tip number three is not to miss out on the heel hover, which is this point where the swing leg foot reaches the top of the arc, then is brought down to the ground in a controlled fashion, followed by the roll of the foot to the flat. There are several different styles of walking where people miss out on that slight heel hover and instead crash the foot directly into the ground on the heel with a heavy heel strike. One of those styles of walking and posture is an anterior pelvic tilt, where the pelvis, instead of being in a neutral position, is tilted forward or anteriorly. When people walk in that style, it's usually accompanied by an exaggerated arch in the lower back, and the foot passes from leaving the ground directly to contacting on the heel. Here you can see I'm passing through the slight heel hover position before the heel comes down to the ground, as opposed to walking like this, or walking like this, or walking like this. Tip number 4, don't miss out on your walking just because you have osteoarthritis of the knee. Osteoarthritis of the knee, or wear and tear arthritis, is the most common type of arthritis that people get, and it is much more common as people get older. It can severely limit people's walking, and many people walk much less because they have arthritis. But the research is clear that people who continue to walk with osteoarthritis end up with less pain than people who stop walking. If you stop walking, the supportive muscles and ligaments around your knee are going to weaken, and that really is going to make your problem worse. But I am going to give one caveat here. I strongly believe it is important to walk correctly to maximize your ability to keep walking without pain. If you have osteoarthritis in the knee that wasn't caused by an injury, I believe it's highly likely that the way you're walking is contributing to that arthritis. So trying to modify the way you walk and place more softly on the heel with a gentle roll forward rather than crashing into the foot or some of the other problems with walking that I address in my videos is going to help you to walk more fluidly and with lower impact on your joints, and that's going to allow you to keep walking much longer without pain. For tip number 5, I'm going to go out on a limb a little bit and recommend that people walk heel first, followed by a roll to the flat of the foot. I didn't put this in my original top 10 tips video because I thought it went without saying. However, I've gotten so many comments telling me that I am misinforming people about walking heel first that I thought I should address this. There is, I think, a small number of people out there that are really believing that people should not be walking heel first, that they should be walking forefoot first, and some people think midfoot first. I'm not going to go into the detail of heel strike. I've talked about this in many videos where I discuss the difference between heel strike and forefoot strike and why people should naturally be striking on the heel. But if you're out there and you've been researching how to walk properly, you may have come across many of these videos talking about how heel strike is incorrect and caused only by modern footwear. You can check out some of my videos on heel strike versus forefoot strike, which I'll link above and in the description section for more detail. But suffice it to say, I'm going to double down here and say that we should still be walking heel first. It is natural, it is the most efficient, and if you do it correctly, like I'm describing in this video, you're going to be able to do it well and without heavy impact on your heels or your knees, and you're going to do just fine. For tip number 6, I'm recommending that people try out at least part of the time barefoot walking or walking in minimalist shoes. Walking barefoot at least some of the time can help people to get better proprioception or feel for the ground and better connection to the ground, and it also is going to help people reduce overstriding. Because one of the points that a lot of the forefoot strike first people talk about is the effect of modern footwear. And they're not 100% wrong on that matter. There is a grain of truth in a lot of things, even when the overall conclusion is incorrect. Walking with very heavily padded shoes and shoes that have a high lift on them can cause people to overstride or land with a heavier heel strike than is normal when people walk barefoot. Walking barefoot can help you regain that natural stride that people have with a better connection to the ground and reduced impact. because it's going to be very hard to heavily heel strike when you're barefoot. So it's going to generally cause people to take shorter strides than they would be otherwise. And that is going to help out your overall walking technique. I do recommend a little bit of caution for people who suffer from chronic plantar fasciitis. We generally recommend arch supports and avoiding going barefoot for people who have this condition, especially in the acute phase. So if you do suffer from recurrent or chronic plantar fasciitis, I would recommend trying out barefoot walking or minimalist footwear walking, however, not when you're in the middle of an acute episode. Of course, there are some other obvious reasons to exercise extreme caution if you plan on walking outside barefoot, especially if you're not going to use minimalist footwear. Tip number 7 is to power each step with the hip of the standing leg, not the hip of the swing leg. When we're walking, there's a point where both legs are on the ground. This is called double leg stance. Then there's a point when only one leg is on the ground, and that is single leg stance. What we should be doing when we walk properly is powering each step with the hip of the standing leg, driving the motion from that standing leg, not powering it from the hip of the swing leg. In normal gait, when we're walking properly, we touch down with the heel, lower the forefoot, and then we swing through. And that swing through portion of the gait is going to be powered by the hip of the standing leg. In this case, that's my left hip, is going to pull the body into the swing through phase of gait before I then lower the heel down. If your feet are facing forward after you get to this position before toe off, if you try to power the motion with the hip of your swing leg, what you should see is that your leg might go up in the air, but the body does not travel forward. One of the exceptions is if we instead swing with a turnout of the foot using the swing leg hip, and that will allow the foot to go forward, but it's going to turn the foot out at an angle. And so what that leads to is what we see so many people doing is walking with duck feet, with their feet turned out, because they're powering each step with the swing leg hip, not with the standing leg hip. So when you're walking, practice using the hip of the standing leg to pull the body into the swing phase of gait. If you do that properly, you're going to notice a couple things. One of them is what I covered in a previous tip, is you're going to pass through this heel hover position before you lower the heel down. The other is you're going to notice that you're not pushing against the ground, and you're not going to have to lean forward like this to take the step. Again, I would suggest watching my How to Walk Properly Pull, Don't Push to understand that power from the standing leg hip. It may look like the swing leg is powering the movement as you swing through because it does move in front of the body, but that is primarily because of the rotation of the pelvis from the lower abs. The lower abs are turning towards the side of the standing leg, and that is what is rotating the pelvis around and bringing the swing leg in front of the body. At the same time, the upper waist is turning in the opposite direction from the lower abs, and that's what's getting us to face in this straightforward position, as I demonstrated before in that hover phase of gait, right before we bring the heel down by rotating in the opposite direction. Tip number 8 is for those of you who suffer from chronic rotator cuff shoulder problems. It's quite likely that you're assuming the problem is all in your shoulder, and you may have been doing physical therapy exercises over and over again, trying to strengthen the external rotators and get your shoulder into the right position, but for some reason you can't correct your rotator cuff issue. What I suggest is that you need to look down at your feet, and you might find the problem there. I find very few exceptions to the rule that people who are suffering from chronic rotator cuff problems are standing and walking with their feet turned out in a duck-footed position. Why would this be? It's because duck feet is not coming strictly from your legs. Duck feet is coming from improper core movement, and that improper core movement not only affects your legs, it's going to cause your shoulders to internally rotate where the palms are facing back instead of the palms facing the side of your thighs like they should be when we stand and walk with normal posture. So if you have chronic rotator cuff problems, take a look at your feet when you walk, and you'll probably notice that they're turned out at an angle. And with this, you'll also notice that your palms are facing backwards. When we walk correctly, the thumbs should be facing forward and the palms facing the side of our thighs. That's what you're going to have for normal posture when you're standing and also when you're walking. I suggest that you're going to have to fix that issue before your shoulder is going to get better, because it's the core positioning that's causing your feet to turn out that's also internally rotating your shoulder and pinching your rotator cuff underneath your shoulder bone. If you can get the proper walking technique, your shoulder positioning will naturally go into the right place rather than trying to do it by working all these muscles here, forgetting that our positioning of our extremities is primarily governed by what's going on down here. Tip number 9 is to begin some type of exercise or activity that requires developing some knowledge of how we use the core muscles to move the body. This would be activities like dance or Tai Chi, where we begin to learn how motion of the core places our legs and our arms, directing the body where to go and how to move. You can learn this type of either subconscious or conscious control of the core with activities like dance or Tai Chi that connect your core movement to your leg movement. Because many people believe, even people who teach walking, they believe that all of our movement when we're walking is coming from the legs, and they only focus on the muscles in our hips, legs, and feet, and they ignore everything that's going on up here. But the fact is, when we're doing any activities standing on two legs, all of the movement is guided by what's happening in your waist. And that is what's placing your foot in different positions. And you're only going to be able to control that movement if you control the movement of the core. Having some type of knowledge about how to move the core is going to be really essential in learning how to place your feet softly and with low impact. And that is going to allow you to move more fluidly, more consciously, and with lower impact on your joints. My 10th and final tip, when you finally decide on what you are looking for in terms of walking technique, if you decide you like my approach, you like what I demonstrate, then I encourage you to sign up for the Walking Code members group, which is on my website, which I will link above and in the description section. Thanks for joining me for this video. If you've gotten this far and haven't already clicked the like button, of course, go ahead and do that. Also, make sure you're subscribed to the channel and click on the notification bell so you'll be able to see all my new videos when they come out. I'll see you in the next one.